All right, welcome to another episode of Medicine Mondays. Yours truly, Dr. Barry Pierre, your favorite board-certified internist, host of Medicine Mondays, Lunch Learn with Dr. Barry, amongst a slew of other things. Today, I think I want to get a hold of what it means to have preventative health care, because I think it's a term that gets thrown around a lot. Everyone does preventative medicine. Everyone's talking about preventative measures. No one seems to know what that means for me personally, because when you hear these terms, preventative care, like, and you're 18 years old, and you're 25 years old, and you're 40 years old, you're 50 years old, they mean different things. So to say, oh, you just make sure you're following up, make sure you're staying ahead of your preventative maintenance, like it has to mean something personally to me so I can understand exactly what you're talking about. So I'm actually going to do one thing for you. I'm going to break it up in age blocks. So once you hear your age block, you'll know, okay, when I hear preventative medicine, this is what Dr. Pierre says I need to focus on. Because when we just say preventative medicine and you don't know if I should be getting exams or tests or blood work or image, you don't know what I'm actually need to be getting, and it's very confusing. I want to talk to y'all about some of my patients, right? I've taken care of over years, and again, I've taken care of patients from 18 years old. I'm an internist, so from 18 all the way to death, right? And a lot of times when I ask that general question, they get kind of confused. When I say, hey, have you been keeping up to date? Have you been following up? Have you been doing your preventative care? Because we know preventative care obviously saves lives, saves money, saves a whole bunch of other things, but most importantly, saves some lives, right? Which we have to understand that the conversation I'm going to have to that 25 years old when I say preventative medicine is going to be a lot different than that 45-year-old when I say, you know what? We got to make sure you're getting preventative care. And if they understand that it's going to be a lot different, they understand that the stakes may be higher or lower depending on your age bracket, depending on any family history. So we're not going to necessarily deep dive in like, oh, specific family history. If you're in that age group, this is what we mean. These are tests that you should be looking for, or you should be asking your doctor for or about to say, hey, like, when do you think I need to worry about this, right? Because I think a confused soul, right? A confused soul, confused person doesn't make a decision. So if you're confused at what you should do, guess what? You don't even make the decision to go to the doctor. You don't make the decision to ask for the test because you're not even sure what you're supposed to be asking for. And I would hope that the doctors that we do go to are up to date and aware and understand, like, all right, based on your age, this is the things that need to happen, especially now. With the way technology is, especially with these, electronic medical records, I've been at somewhere like they just start pinging you like, oh, this person's 25 years old. They should get this test. Did you order this test? Did you ask about that? There are things that just tend to occur that, again, we don't necessarily want to rely on technology. And if you're down with me, right? If you're on team Empower Yourself for Better Health, if you're about trying to think like a doctor, you understand that you have to know, I'm not saying as much, but you have to know in the ballpark of what's going on for you more than anything else, right? So let's start with our first group. This is my group, supermen and superwomen who think everything in life is beautiful, which it is, right? But and when it comes to their health, they're not, they don't go as hard as I would love for them to go, but I understand why, because they're younger, they tend to be a little healthier. So let's talk about my young age group here. So I just want to make sure we get them recognized, right? Because again, my younger adults, and I got plenty of young adults who watch the channel or listen to the podcast. So things that you should be looking for, right, as a young adult, right? This is where we start saying, hey, just get your routine exams. That's my once a year physical exam where I'm going to the doctor's office, where I'm checking my blood pressure, where I'm checking my cholesterol. I want to make sure I'm not an early diabetic, younger, typically more sexually active. I'm making sure that I don't have any sexually transmitted infections, right? There are things that the younger crowd needs to, have more of a high alert on than different age group. 18 to 40, 18 to 39, start thinking about just your regular routine screenings. Start thinking about making sure your blood pressure is fine, your cholesterol is fine. If you're sexually active, making sure that you are clean, right? Making sure that we are checking for all of these things here. And we tend to do a lot more discussion in this age group with lifestyle habits. We tend to do a lot more conversation with diet and exercise because we understand the significance and importance of making sure that group is taken care of. Why? Because, and this is where I think the foundation of preventative care kind of is birth. We understand, again, well, I'm gonna start getting capitalistic on you guys. We understand that if we take care of this age group here, it saves us a lot more money down the long run. We understand when we don't take care of this age group here, when we start talking about our other age groups, we're having to play catch up. It's more expensive to play catch up, and more people die because we're playing catch up, right? So these are things where if we hit the age group, the young age group early, hit them often, but hit them with something that is actually viable to them, they'll not only follow what we're looking for, they're going to follow it, right? They're going to follow our directions, but they'll be able to kind of maintain it. Because it's one thing to go off to a doctor one time and then you don't see a doctor for 5 years. No, we're not doing that. So even if you're 18, 25, 30, 35, and you don't take no medications, I still want you, in fact, I just got from my doctor's appointment last week, right? I still want you to have your yearly exams. It's important to still have your yearly exams because that's when a lot of these things happen. That's when I'm checking your blood pressure, I'm checking your cholesterol. If there's any family history, I may check for diabetes. I'm making sure I'm definitely checking for any, especially if you're sexually active, any sexually transmitted disease. And I'm talking to you more about the lifestyle changes you should work on, dietary changes you probably work on, your exercise, your sleep, right? Your mental health, right? Because we're going to ask a lot of, are you depressed? These are the times that we're going to hit home, right? So my young crowd who I know are like superwoman and superman, and, they're just, they're like, what, all the world is mine. There's no issues. There's nothing that can stop me, right? Yes, you're young, right? So yes, the likelihood of some stopping you is probably going to be lower, right? But I want to make sure by the time we get to these older age groups, you're not having to try to play catch up, right? So big thing for me, lifestyle, dietary changes, exercise, physical activity changes, and it's just kind of your routine workup. Usually we see these people like once a year, right? The next group I want to focus on is my adults, right? So we talked about the younger adults, that's the 18 to 39. My adults, right? 40 to 64 years old. Again, we're still doing all of the same stuff we did for the younger adults, but this is when we're start asking a little bit more deeper questions, right? We may get into the business of, hey, what's going on with mammograms? What's going on with your prostate exams? What's going on with there may be some imaging stuff that we start doing around this age group here, because we know the significance, especially as we get older, of trying to prevent the C word, cancer, right? So cancer is a big concern in our adults, right? Age 40 to 64, right? So we start having a lot more preventative measures, whether it be blood work, whether it be actual, imaging type testing to try to prevent the cancer word, right? Because cancer is prevalent in us. Now, again, I'm not saying that my younger adults don't deal with cancer, right? Or, see Chadwick Boseman. I'm not saying that. I'm just saying that the likelihood that you're going to have to even deal with these types of questions or concerns when you start becoming, again, 40 and up, right? That's when you start having the quote unquote midlife crisis. You start thinking about things a lot more. You start getting into that age where your older relatives, right, maybe start passing away, right? So you start internalizing a little bit more extra stress, and you start thinking about your life a little bit more than you did beforehand. When you were a young adult, you thought you could live to 100, and then you hit 40, and then all people, start passing away around you, and then you start getting a little bit health conscious, and then you start trying to explore and do these exorbitant things because you're like, hey, you know what? I don't know how long I'm going to live, right? Again, this is not for that. This is just us to kind of open our eyes up to say, hey, when I get to that adult stage, right, there are some adult things I got to do when it comes to taking care of my health. Yes, I want you to still focus on diet and exercise, physical activity. Yes, I still want you to make sure your yearly exams, but you may have to see your doctor a little bit more often, right? Blood pressure starts creeping up, diabetes start creeping up, cholesterol starts creeping up. All these other things start adding together, right? And then again, for women, you're making sure mammograms are done during young adults, but obviously pap smears are still kind of going on strong. So these are things that we have to be concerned about. My colonoscopy ages, this is when this starts happening. So a lot of things start moving once we hit our 40s. So when we talk about preventative medicine, right, especially in our adult stage, like now we're doing a lot more diagnostic testing than we did before, right? There's still some blood testing. Obviously, we're still checking for the baseline stuff we did as a younger adult. But when we get to older, that's when we really start trying to hit home. All right, we really got to make sure the cancer screening is much improved and much more up to date, because this is when it can become a problem. All right, so my final age group, right, at least for the internists, is my senior citizens. This is the 65 and older crowd. Shout out to my 65 and older crowd, especially those who are a part of the Lunch and Learn community, listen to the podcast. Shout out to y'all. We love y'all because I know a lot of y'all are checking in. I think one specific thing with this age group here is we start going into management mode, right? Because by the time it hits 60, 65, 70, like we've already diagnosed you with high blood pressure or cholesterol or diabetes or arthritis. We've already kind of diagnosed these things. So now we are obviously we're still thinking about the C word, right? We're still thinking about the cancer. We're still thinking about our screenings, right? But all of a sudden, what we have hoped, if we did a good enough job during your adulthood, maybe we're not testing you as much for cervical cancer, right? Because we've had enough pap smears in a row, right? Maybe we're still doing mammograms, but again, it's not as frequent, right? Because we've been doing them as frequently as we were supposed to, right? Colonoscopies is another thing that we don't do as frequent in our senior citizens that we typically did with our adults, right? And again, this all relies on, did we do the things we did in the last group, right? So when I was a young adult, did I get my yearly checkups? Did I, get my sexual disease testing? Did I do, check to make sure I wasn't depressed? Did I do those things there so that when I became an adult, when I hit 40, I didn't have midlife crisis. I was still getting my regular checkups. I was still doing well with my diet and exercise. And now I was thinking about, all right, the C words. I was getting my screening, my mammogram, my colonoscopies, my PSAs for prostate cancer, right? I was doing those things there to make sure that when I hit my senior life, right, I'm just in management mode, right? I'm just making sure that my medications are still working. I'm making sure that my screenings are up to date. I'm just kind of cruising, right? Because we know that we likely have more life, where we have more life behind than more life in front. And we want to enjoy it. And this is where putting that money in the bank, aka taking care of yourself when you're a young adult and an adult, starts paying for itself when you're senior citizens. I take care of a lot of elderly patients who are decrepit, who, can't move around, just kind of live a sedentary lifestyle because they can't do anything. And it's because they didn't take care of the job that they were supposed to do when they were a younger adult and didn't do what they needed to do. So now they have to pay for it when they're 65 and older. I don't want you to pay for it. If you're watching on YouTube, say, I don't want to pay for it, right? I don't want you to do these things that will force you to have to kind of be living, right? I want you to actually enjoy your life, right? Because I know a lot of my senior patients who enjoy life. They're always traveling. They're always out and about. They're moving around, right? They may have a cane or something just to make sure for falls, right? Because that's the thing too, right? When we talk about preventative medicine, I want to make sure you're not falling, right? Because again, a fall when you're an adult, you get right back up. A fall when you're a senior citizen, you might break your hip. I don't want you to do that. But if your vitamin D, if your calcium, if your nutrition is on point like it should have been as a young adult and an adult, guess what? Your fall as a senior citizen shouldn't be as bad, right? These are conversations that we got to start having for my senior citizens to live that good life. And I don't think a lot of people think about that. When you are 18 or 39, you're not thinking about, when I'm 65, do I want to be able to cut a jig? Do I want to be able to travel? Do I want to be able to drive? Do I want to be able to do these things that I normally like doing now? Or do I want to be a person who I just get up, I take 30 different pills and, I just sit on my couch all day. My body hurts, my knees hurt, my hips hurt, everything hurts, right? Do you want to be like choice A or choice B? Red pill or blue pill? Tell me, which one do you want to do? It's an obvious choice for me. I want to be able to move around. I want to be able to travel, enjoy my kids, right? If I got grandkids at the time, enjoy my grandkids. I want to enjoy all of that, right? And I don't want to have to suffer when I'm a senior citizen because I didn't take care of my body the way I should have took care of myself when I was in the younger age brackets, right? So that is the big thing for me, especially for my senior citizens, because like I said, everything is building upon it, right? So yes, we are still checking it, doing your physicals. You may have to see the doctor a little bit more frequently. When you're a young adult, once a year was fine. By the time you're a senior citizen, you're probably seeing us 3 to 4 times a year. We're checking on your blood pressure, checking on your cholesterol, making sure your body's not hurting too much. You're probably seeing us a little bit more frequently, and you should, right? You should see us a little bit more frequently. We're still doing our screenings, right? Again, we may have less invasive screenings, more blood tests, just to kind of make sure we are doing our job and making sure that you can enjoy your life, because I think that's important, right? We got to enjoy life at all the stages. I want to enjoy my life as a young adult, as an adult, and as a senior citizen, right? To do that, I have to build upon the foundation of good preventative care, right? So when you hear someone say, hey, you know what? Make sure you're doing your preventative care. Understand that, like, all right, I am 18 years old. What does that mean for me? I am 30 years old. What does that mean for me? I am 40 years old. What does that mean for me? Because once you understand what that means for you, right, all of a sudden, you're not a confused person no more, right? Again, confused people don't make decisions. You have so much clarity when it comes to your health. And then, of course, if you follow someone like myself, right, who makes sure I put the little sprinkle on to make sure, like, yep, you're right. You should do that. You're 40, you're 45. You should go get that test done. You should go look out for your vaccination, your flu, your pneumonia, your COVID. You should do all of these things there, right? Because again, like I said, we want to be able to cut a jig when we're 65. That's the goal, y'all. We want to enjoy life at every stage. I don't want you to just enjoy life when you're a young adult and an adult. I want you to enjoy life when you're a young adult, an adult, and a senior citizen, right? I want you to enjoy all three phases of your life. And how do we do that? By great preventative care and making sure you got someone on your team, you're a healthcare professional, right? Making sure you got someone on your team who understands the game plan for you, because the game plan is to get old, but enjoy doing it. So I'm yours truly, Dr. Barry Pierre. I'm going to see you guys next week.